Good day, I'm Maria Susette Karampatan, first year nursing student. For the community health nursing, please meet my online client, Geraldine De La Costa, 18 years of age. Their family recently residing in Suarez, Iligan City. The day of my online evaluation, first I gathered data that would help me in prioritizing for my health teaching plan and educate the client to address the condition. The families used to be a member of 5, with both parents died at an early age. Back then, Jara was then on her elementary age, while both Jove and Jas is on their college years. 2 years ago, their father followed, leaving the three of them as survivors. The eldest brother, Jove, who stands as the head of the family, earning 20,000 pesos a month as a web designer, while the other brother, Jas, is a freelance online earner as well. Jera is still studying at La Salle, Iligan City, a senior high school student, with only the eldest brother, Jove, shouldered all the financial obligations for the three of them, because the other brother, Jas, didn't have a fixed income. There are two problems cited in the family. First, the illness state. Moderate pain secondary to scoliosis that says that the client used to wear braces before but wasn't able to go for follow-up and brace replacement, and that moderate pain increases by the time. Carrying heavy school bags is usually on one side only, and that the client complains moderate pain at daytime during playtime activities. Second problem is the stress points due to the death of a member of the family, the father and the mother. There, the responsibility of parents was abruptly transferred to the eldest brother at early 20s who is not financially and emotionally ready. Second is that adolescence is difficult without parents. Jaira had focuses in school. Her brother Job cannot fully concentrate on the job while Josh loses eagerness to pursue medicine. The siblings are still unable to cope with the loss of especially the mother, with whom they are emotionally attached to. The first problem, which is the moderate pain secondary to scoliosis, is said to be a health deficit identified on the 30th of June 2020, and now the client is still working it out from the learned activities about scoliosis exercises. The second problem is the stress points, which is the death of a member of a family, the father and the mother, is considered to be a foreseeable crisis. It is being identified on the 30th of June 2020, and now the client and her siblings are still coping with the stage. Ranking of family health problems, I prioritize the illness as moderate pain secondary to scoliosis with a score of 2/5/6, which is considered a first priority among the two problems. However, there are significant information gathered. After my initial and second level assessment, I found out that first, there is a moderate pain secondary to diagnosed scoliosis, which is considered a health deficit, and second, the health of a family member, which is considered a foreseeable crisis. Among the two, the moderate pain secondary to scoliosis that scored 2/5/6 ranks the top priority that calls for instructional health teachings. The goals include that after 2 weeks of intervention, the client can associate skills related to scoliosis home management. On the day of online teaching, client Jero was interactive about how was the condition affects her health in the future. I also include the maintenance of stretching and strengthening exercise of the core muscles with a brochure attached I sent on online that serves as her guide. I also sent Jera a copy of exercise routine to do every day. As of to date, my client is still working in progress with the exercises set for her. Complaint of back pain secondary to scoliosis has lessened, though not completely diminished. With an interventional plan that focuses on pain secondary to scoliosis, the goal of care is that after 2 weeks of nursing intervention, the family can associate skills in teaching related to scoliosis home management. With the objectives is that after 2 weeks of nursing interventions, the family will be able to correlate the exercises taught in teaching in relation to activities of daily living of the client, and that after 2 weeks of health teaching, the family and the client will be able to learn alternative techniques to minimize the progress of scoliosis. With the nursing interventions that first says, we discuss with the family alternative ways to minimize the progress of the spinal curvature through core muscle and strengthening and stretching exercises and proper body mechanics, and analyze with the family the advantages and disadvantages of the treatment and encourage them to choose better decision and possible options. For the conclusion, the crisis we are facing today brings more challenges, especially amongst the healthcare delivery system. Reaching to the family for survey, orientation, and teachings are limited. However, it would only be feasible with a client or client's family's cooperation. In my client's case, left independently with her brothers is far more difficult than those sheltered under the care of both parents. With only the eldest brother at young age without experience, who swipes all the household finances, means a stress points, considered a foreseeable crisis. On the other hand, bothered by moderate pain brought about by scoliosis is considered a health deficit. The biggest demand for this project is time and doubled efforts in reaching out knowing our limited resources. But with the advanced technology, I came up with a new method of data gathering, interviewing, and health teaching through the use of the internet. Willingness to learn, I was able to partake my knowledge taught to the client, which is expected to continue even after results are achieved. As part of this community health program, it is my pleasure to experience such a unique method. Lessons learned from this community nursing. First, that despite the crisis and far from our clients physically, with the help of our modern innovations, we could still reach out to help others. Second, as a student nurse, there are platforms that I can utilize to be of service to other people. And finally, being an online teaching is not just a challenging obligation, yet it is a fulfilling after exerting all the efforts asserted by yours truly.